The rolling plains of Kansas are crisscrossed with a dozen railroads and several major highways or interstates. And as the state sits at the geographical center of the lower 48 states, it's a perfect situation for heavy drug trafficking. The Drug Enforcement Agency reports significant seizures of drugs and drug proceeds at rail terminals, bus stations, and from private cars. Marijuana is the most heavily imported and abused drug. 1 in 4 Kansans, age 18 to 25, used marijuana in the last year, as did 1 in 7 of those aged 12 to 17. 4,000 people a year seek treatment for addiction to marijuana in Kansas. While more people may be using marijuana, methamphetamine is considered the bigger risk because of its intense addictiveness. Crystal methamphetamine, or ICE, is the predominant local drug and is readily available in urban areas. An estimated 7,000 people use methamphetamine each month, and 19,000 use it every year. Admissions to treatment for meth addiction have been steadily increasing, approaching 2,000 in 2005. Increasing numbers of people also abuse prescription drugs in Kansas. Among young adults, 1 in 10 abused a prescription drug in the past year, most likely OxyContin. Some people switch from illicit drug use to prescription drugs because of their purity. Much of the spirit of America is drawn from the good people in the heartland. Those who have become addicted need intensive help to return to full health. Sadly, in 2005, 54,000 people needed treatment for addiction to illicit drugs, and 186,000 people needed treatment for alcohol addiction. The right time to get help for those abusing or addicted to drugs or alcohol is right now. The next time the addicted person uses meth, heroin, cocaine, alcohol, or any other drug could bring disaster or incarceration. When looking for an effective drug rehab program, determine if the program in question has a treatment system that effectively eliminates the 3 basic barriers to a successful recovery. They are the cravings, guilt, and depression suffered by every addicted person. When an addict can leave guilt, cravings, and depression behind, then they can build the skills to make drug-free choices. And when real recovery is attainable, Kansas builds a better future for all its citizens. So get help now. For NNTV Drug Rehab News, this is Tim Gozansky.